remind me your name again?
Teresa.
Teresa. So Teresa, tell me what's going on with your shoulder.
It's my right shoulder. Limited movement
Yep.
due to impingement. So I've been going through therapy. And of course, as you said, it's therapy, but you have to break your old habits.
Sure. So this is a little different. She's an active course of therapy. Like I usually don't want to mess with that, but she's here for the 5 minute miracle.
What the heck?
We'll mess with it. Like I don't want to disrespect others.
No, I'm not asking you to. I'm just making sure I get the treatment that I need from whoever it is.
Sounds great. Yep, I'm all about that too.
Okay.
So let's do this. Your right hand dominant?
Yes.
Okay. If you wouldn't mind, take your left thumb and reach it straight up over your head. So, she have perfect range of motion? No, but it's a little stiff, but it's kind of similar to what we'd expect for somebody of your vintage. Come on down.
Vintage? Of your antiquity?
Vintage, I think, is a little bit cooler.
Okay.
Obviously, she's got loss of mobility there, right? So that's the first Captain Obvious thing. That's the first thing. Okay, leave that go, please. So she brings that up about 90 degrees. Now, Snow Angel with your left arm, please. Leading with your thumb. Okay, that's pretty decent. Now the other side. Okay, so I'm starting to build a case here for what it might be. Leave that go. So yeah, clunk down, right? So not sure what's going on. I'm gonna start to test the integrity of the rotator cuff. I wanna know what that rotator cuff can do. It gives us lots of information. Bring your elbows in, hands out. We're gonna test this side first. Maintain yourself. This is gonna test your external rotators. Excellent. Hand in your tummy. Bring your elbow forward. Bring your elbow forward. This is Napoleon sign. Napoleon, the emperor. Hold. Good strength there. Awesome. Now you're going to bring your arm up to the side, your elbow up. You can take your hand away from your belly. Thank you. Simon didn't say. Bring your hand back. Hold it there. Don't let me move you. Good. That's the smallest of the rotator cuff muscles. That's your teres minor. She got a good teres minor. Watch out. Lower your elbow a little bit. Push your hand forward. That's a test for some instability issues. Good integrity on this side. I kind of want to see how strong she is, right? Of course, if I'm seeing her in the clinic, I'm going to ask a lot more questions on the front end, right? Get to know her, what her lifestyle was, all that kind of stuff. But she's coming to the senior center on a warm day, so I know she's serious about her shoulder and wants to get looked at for something like that. Now, out to the side. She can maintain her hand there. That's good. Hold. Don't let me move you. A little bit of weakness, but not horrible. Hand on your belly, elbow forward. Good. Leave that go. Allow me to move you. Hand back. Hold it back there. Good integrity and strength of that rotator cuff. I like that. Now, if you would please, have a seat here. Tell me about any history of neck trouble.
Of course.
Years. Quite a lot.
Yeah.
Treatment there, car accidents, anything like that?
Car accident years and years ago, but it's more right now it's due to the rotator and going up.
Have a seat here, please. Just sit down.
Okay.
Please. Cross your arms like this. I want to check out what her spine movements are like. Turn towards this way with your head too. And towards the other side. So about even each side. I'm going to do a little bit more here. So take this hand, bring this down, bring this hand here. I'm going to feel along her back ribs. Any bother in through here?
There.
Like that doesn't bring on your pain though. Just
no, it's a tender.
Okay.
Yep.
Look over your right shoulder, please, as far as you can. Any bother there?
Pull.
Pulls into your shoulder. Look over your other shoulder. Any bother there?
No.
Okay, straight ahead. Right now at rest, do you have any symptoms in your shoulder? Right now at this moment?
No.
Tilt your head a little bit this way. Anything now?
No.
How about now?
Tenderness in the neck.
Tenderness in the neck. Didn't bring on your shoulders still?
No.
Okay. Thank you. Lie on your back, please. So I was testing to see could we provoke some of her symptoms by challenging the neck. By the way, do I have permission to treat you? Examine you?
Oh, is that what you're doing?
Yeah.
Okay, yes.
Thank you.
I have witnesses.
My daughter's a compliance manager. She looks at this video, she's like, you didn't get permission.
Oh.
Love her dearly. She makes sure I don't get into trouble. So if I block the shoulder blade here, this upper arm should go about 120 degrees or about up to her earlobe, bottom of her earlobe. allow me to move you. She's always trying to be in control. Pretty close, right? At 90 degrees away from her body, she should have hand go back like that. And if I block her shoulder here, her fingertips should almost touch the table. So good mobility here, good strength. We're going to test her other side now. I'm going to just gently cup and block her shoulder blade. Whoops, not a lot of mobility there. Not a lot of mobility there. Not a lot of mobility there, right? So I'm starting to think that she's got what we call a hypomobility issue, primarily. Hypo means less than, mobility is mobile. So her ball and socket joint just doesn't move that much, right? I'm just gonna ask the question. Has anybody done like work through that rotator cuff or that shoulder joint?
Manipulations
Mobilization
on that?
manipulations?
Right now, you've probably felt that I have the, rock something, those,
Rock tape?
yep,
Okay.
no good.
I'm trying to be, I have no idea who's treating you, right? So I'm trying to be responsible.
Right,
So
exactly.
I'm a practical guy. I grew up across the street from a grain elevator. My folks were farm. I was never raised on a farm, but parts gotta move. Her shoulder, her ball and socket joint has about 1/3 of the movement it should. Like, I don't care what kind of muscle balance she has, she can't move, it's stiff, right? That thing's gotta be loosened out, right? In my opinion, right? So that's where I'd go first, right? So I think this is a hypomobility issue. So with that, you want to maybe move that, I don't need to move that. Stand your back and slide towards me. What am I going to do about it? Stand your back, stay on your back, and slide towards me. Thank you. I'm going to do it with some gentle joint mobilization techniques. And I'm going to use a chair here so that you can still see me. So what I'm going to do is I'm going to do some controlled movements in which I'm going to do something like this through the joint in different ways. I'm going to fiddle with the joint a bit, right? In a sophisticated way. I'm supposed to actually talk about it being sophisticated because I've, got to document some stuff, right? So, well, maybe that's not the right angle for me. Sorry, you don't get my best view
Okay,
here.
class, move over to this side, please.
Tell you what, watch you swing around the other way. You're agile, so you spin your head to the other side.
Like that?
Sit on up, and your head on this side.
Oh, okay.
Slide down a little bit towards your feet. Come a little closer towards me. That's it. Perfect, thank you. I'm accustomed to working with mobile chairs. I'm not on the right shoulder, am I?
Yeah, you are.
Okay.
Isn't that right?
She's got spun around, and I got spun around.
Yeah.
Okay, so what I'm going to do is I'm going to give a little bit of traction here. Everything should be comfortable. Want to make sure might be willing to come back, so I'm not going to terrorize her. And
Yeah.
PT does not stand for pain and torture. If you're doing exercises or intervention that's painful in therapy, like stop. It's not the intention. It's telling you there's something wrong. So feel a little bit of motion in that joint there, a little bit?
A little.
Yeah. Not a lot though.
You're just pressing on the joint.
I'm trying to help that joint reclaim some of its mobility so that you can move more comfortably and further. Again, you've got loss of flexibility. So intervention should be about reclaiming that flexibility and then retraining your strength within that newfound flexibility.
Okay.
Now, in a few moments, I'm going to have her sit up, and then she's going to reach her arm up in different directions. We're going to have a chance to see if we have some sort of immediate change in her position or in her ability to move. This is the starting point, right, for her treatment. She also has lots of associated muscle tension, so we probably also use muscle massage work between the shoulder blades, and And then as she gains more flexibility, you can kind of envision that she's gonna need a little bit more strength through that newfound range. Does that make sense? So we're gonna strengthen within her newfound range and keep progressing that over time. What do you notice about that now?
Looser,
Nice, good. All right.
Better range.
Outstanding. So she's not after better range while she's on the table, she's after better range in her daily life, but that's a good confirmation that things, she loosened up, she relaxed. It's the first time she's met me. She's good to be a professional PT patient, so she's able to relax reasonably well. That's good. Have a seat. But I felt a response in there. She's noticing a difference. Now we'll see what kind of difference that makes in your movements.
I'm just curious. Oh,
Yes.
no, you're fine. Okay, so when she sits up from the table like that, do you feel pain when you're moving?
not unless I'm putting pressure on, I just,
If
you
you
kind
use
of,
your arm to
come
move your
over,
body or
right,
have it body.
right.
Okay.
you avoid it,
Mhm.
I've been trained to avoid it.
Right, okay.
For sure.
Mhm.
All right.
Okay.
So she didn't have a lot of pain at rest necessarily, so I can't really test for that. So
Right.
lead with your thumb, reach your way up and see what it's like now. What do y'all notice?
It's a little better. It's
A little further.
Yeah, beautiful. How about to the side?
Yeah, that's good.
Boom. That's it, right? Doesn't have to be overly sophisticated or complicated. Coming
Got a pinch
down,
there.
coming,
Gotta edit that one out.
her shoulder, yeah. Well, we can keep that in, right? Like, we need a reason for her to come back. Like, come on.
Like, look at this, you did that.
Right, so, if we can get a change, even in the short term, here after intervention, that's a great sign, right? This is changing, right? Obviously, she needs other things with this, right? So as she gains more, she needs more mobility in multiple directions. It's got to get a little bit more sophisticated, do a little bit more. And then we got to strengthen within a newfound range, right? And then ideally, she's at a point with intervention. She has just a couple of simple mobility exercises that she does. She's got a nice tight exercise prescription that's individualized to her. Maybe a couple days a week, she does some strengthening, and then she's back. You wanted to play pickleball, right?
No,
It was a pickleball.
Other
You wanted
lady
to-
did.
What you want to get back to?
live life.
What's that? Live
Live
life.
life.
Live
You know, you get a lot, you read a lot at my age, or I do. And between, holding a book, having your head down, working on an iPad that has all of this motion, is that
Got it. So
after
for,
reading.
so for someone who's a little more bookwormy, that's great. Like you want to use that cognitive ability, right? That's great. I might nudge her to consider, hey, maybe once that shoulder's a bit stronger, let's do some whole body strength training. Senior centers have got a great fitness facility here.
In there?
Planet Fitness, YMCA, you can do stuff on your own to kind of keep some action going so that you keep your muscles up, because your muscles otherwise will start to diminish in strength year by year. And she's going to be a little more vulnerable to re-injuring not just her shoulder but other parts if she wants to remain as active 5 years from now as she is now. Does that make sense? So we might nudge people into that direction because strength matters. At age 21, we all start with a V8 engine for strength.
Enjoy it while you have it.
Right?
Don't blow it.
Don't blow it, right? So that V8 engine, naturally, unless you do specific things, is going to get a bit weaker over time. And at some point, you need enough strength to reach up overhead to grab that platter out of the upper cabinet that you use for Thanksgiving and Christmas and Easter, right? As an example, right? But if you don't maintain your strength and flexibility, then that becomes a challenge, right? It can cause injuries. So.
Start bringing out the step stools.
Right on. So terrific, great response.
Okay.
Again, I'm not sure where you're going for therapy, but I would say, hey, look, you know what? He did some manual therapy, loosened that joint up, and he thinks I got a hypomobility issue, lack of flexibility in the ball and socket joint. What do you think? I think that would benefit you tremendously. And if they look at you like, what does this quack think? I'm just my
Yeah,
humble
no,
opinion.
this is why I attended this, was to find out what is working, so
And she could use some improvement in her posture, sure, of course, but we're not gonna blame everything on her posture, cause her other shoulder has the same postures.
No, and that's why, I've learned to keep my arms here, not down there, so your shoulders don't roll.
Love it,
Yeah.
so, come on down.